Folks, it is really an honor to have our guest on today. I heard about her story and felt compelled to share it with you. Her background is pretty straightforward, at least in my mind. She is, amongst other things, a very, very loving mother who went through an unbelievably painful experience and has, over the last few years, recently, transformed that pain into incredible purpose and generosity in an organization called Christopher Wolf Campaign or Crusade Alliance, CWC Alliance, Christopher Wolf Crusade Alliance. Christopher Wolf was her son, and I'll let Cammie introduce herself and tell her story, and then we'll dive into the big idea here that she believes can really transform healthcare.
Thank you, Dr. Newworth, and thank you for having me today. And I got to say, I love the name of your podcast. Creating New Healthcare is an
Oh,
amazing
thanks.
name. So I
Oh,
just want to compliment you right
thank
off the
you.
bat. So I really appreciate the platform anytime to share the
Mhm.
opportunity to share what we're doing at CWC Alliance.
Mm.
So unfortunately, my story starts with a tragedy. My son, Christopher, had a health crisis, was diagnosed with ulcerative colitis, and then his senior year in high school had a major surgery where he had to have his large intestine removed. And it was aligned with exactly when Oxycontin was released into the marketplace, literally as the wonder drug. And we went home with 90, and I was told to give them to him every 4 hours. And we as a society, we don't question the white coat. And I'm not here to slam doctors. I love doctors. We need doctors. But at the time, there just was not any education about the dangers of opioids. And that one prescription of 90, even though it was followed by more, it literally hijacked my son's brain. And my son was an AP student, incredibly disciplined, and his lifetime goal and dream was to be a Navy SEAL.
Wow.
And
Mm.
so, he fought substance misuse for 14
And so
years.
Cammie, he was prescribed this by the doctors. You gave it as the doctors told you, this OxyContin,
Mhm.
and he became addicted very quickly. And for
Yes.
those who aren't familiar, I actually lived through this as as a prescriber, as a provider. I taught pain medicine to young residents in training in internal medicine. So this was a world I was literally part of, embroiled in. Now we know how malaligned that period of time was, that the drug companies, particularly one, was pushing these medications inappropriately so, and doctors were duped, myself included. What we did not know at the time was how addictive these medications are, that literally some people, and it's, largely genetic, some people can become addicted to these medications within 2 weeks.
Fast forward after 14 years of really, really, really
Mm.
fighting hard, February 26, 2016, he passed away. And, because of stigma, it took me 2 years to even say the word overdose, because sadly enough, I wanted my son to have a respectful death. And
Mhm.
I knew the stigma around and what people thought. And I didn't want them to think poorly of this beautiful child that I had. And it wasn't his fault what happened, right? And he had
Mhm.
fought so hard. But then 2 years, it was 2018 is when I started CWC Alliance. And during that 14 years, Christopher was in the hospital many, many, many times. And I started journaling and dealing with the grief of losing my son. And the only way I know how to explain it is it was literally a fire inside of me that I've got to warn
Mhm.
other families. I've got to
Mm.
warn other parents so they don't lose their children. And I really felt like there was a missing piece to the healthcare team. All the times you go in the hospital, and I started thinking about it. Let's look at our society. We use coaches for everything. Imagine the Super Bowl with no football coach on either line, no
Right.
defensive coach, no offensive coach. There's tennis coaches, workout coaches, executive coaches, lactation
Absolutely.
coaches.
Right.
Sleep coaches. There's
Huh.
coaches for everything except when you're in the hospital with a health crisis. You have no coach at patient bedside. And so I based a new position in hospitals, which between you and I was probably one of the hardest things to choose to do.
Yeah.
But I really felt like I based this position on everything I felt like my son did not have in all
Mhm.
the times he was in the hospital, and I didn't have the coaching as his mom, as his caretaker. And so the life care specialist is the name of the position. And I'm very excited to share everything about the position. But again, I based it on everything I felt like Christopher didn't have. So their job at patient bedside is number one, is to be that coach and to help a patient with their own health advocacy,
Mhm.
helping them to what questions to ask your doctor and how to manage pain. And we did a clinical trial right off the bat at Grady Hospital, which is one of the top trauma hospitals in the country.
Mm.
70% of the patients did not know they were taking an opioid. So that's the thing. You've got to educate people if you have to be on an opioid. There is a time and place where you might need to be on an opioid, but you do need to understand
Wow.
how quickly you need to taper off,
That,
right?
that's Kim, that's amazing. 70% of the patients in the study you did at Grady Memorial Hospital in Atlanta, Georgia, 70% weren't even aware that they were being given opioids. So you could have done a lot of things, but you decided to create this role, this life care specialist out of this organization, CWC Alliance, which is a nonprofit, and you who like what type of patient will get assigned a life care specialist? Would they be there every day? Would they be there on the phone? A little bit more descriptive about what that life care specialist would do and for whom.
Absolutely. And that's a great question. And I'll state first off, we as a country don't do well at preventing things. We deal with the problem after the fact. Less than 3% of funding goes towards prevention. And so CWC Alliance, our swim lane is prevention. We need to stop it before it ever starts.
Mm.
So many times, addiction starts with a prescription, with a health crisis, right?
Hmm.
And so initially, we started the Life Care Specialist program at Grady. That is our training hub. We've since expanded, which I'll get into. But we started in the orthopedic trauma unit because that's usually young people's first introduction to opioids. They've had a sports injury, they've had a car accident, and they go in for an orthopedic procedure, and they go home with a Percocet or an Oxycontin, and it could literally change the trajectory of their whole life, which is what happened to Christopher, right?
Mm-hmm.
So we started an orthopedic trauma unit at
Hmm.
Grady. We've since expanded into other departments, but here's the beautiful thing. On the rural hospital strategy, because we're in multiple rural hospitals now, we can see every patient, and they need it. Because listen, here's the thing. When you're in a health crisis, number one, they're there to provide pain management techniques because if you're in the hospital, you
Hmm.
probably have pain, right?
Hmm.
Setting a clear expectation. Look, you're going to have some pain,
Right.
but guess what? Pain tells your body where to heal. So let's deal with the pain. Let's give you some other techniques that are non-narcotic,
Mm.
non-addictive to distract the brain,
Right.
right, when you're in pain. So we have a whole toolkit.
And so,
Uh,
Kimmy, I'm sorry for interrupting, but are these folks trained?
mhm.
Yeah, who are these folks that you hire as life care specialists?
Great question. So we basically the hospital, they are employed by the hospital, and I'll get into how we fund the position and everything as well. But we actually, CWC Alliance, we have the key to the success is we are partnering with so many organizations because we can't do it all, right?
Hmm.
We have an online curriculum at Mercer School of Medicine. So the life care specialists go through 13 modules that's taught by faculty at the medical school at Mercer.
Hmm.
And so you watch a video, you take a quiz, watch a video, take a quiz. Then we also have practicum where we actually do job shadowing at the hospital. Grady Hospital is our training hub.
Hmm.
We're now expanding and training into other hospitals as well. So there's a practicum piece. Then once you're certified, you receive a healthcare pen and you actually receive a certification. The Georgia House of Representatives they did an opioid study. They had a committee because they wanted to see how
Mm,
we can get the deaths to go down.
mm,
And they recommended that all hospitals have a life care specialist in the state of Georgia. So we have just
wow.
now the transition and moving into a certification for the life care specialist at technical schools. So just like you can get an LPN or a CNA relate, you'll be able to get a life care specialist certification
At technical
at a
schools.
technical school.
That's and that's brilliant, and it's amazing. Kudos to the state of Georgia for recommending that these life care specialists be in every hospital. You mentioned the numbers and the deaths. Do you have any statistics at hand just to give folks and myself a sense of how big an issue the opioid crisis still is?
Oh my gosh. So it's the number one killer age 18 to 45 in
The
our
number
country.
one killer.
Opioid
Oh,
overdose and fentanyl crisis. The opioid epidemic and the fentanyl crisis is the number one killer for ages 18 to 45 in our country.
you know, I just have to tell you, this hits home for me. I've got two college age kids, and I have to tell you, the number one thing my wife and I worry about is drugs. That's the number one thing. I think, our kids are good kids. Just like your son, studious, and they take care of themselves, but you never know. You never know who slips what to them,
Right.
and we've warned them. And it is literally the number. And so to hear you say that, then the stat, I didn't realize that opioid overdose was the number one killer of Americans between the ages of 18 and 45, is it?
Mhm.
That I'm gonna be honest with you. I'm gonna share that with my wife as soon as we're done here, because it really substantiates the issue we intuitively knew to worry about and have warned our kids about. A, don't we already have people in the hospital that can do this? That would be one. I think you're to your point, how do we pay for this? Number two. Number three, how does it integrate with the rest of the team? Number four, this is a non-medical person. Are they giving medical advice? So I'm putting those out there because I think it's important. I imagine the listeners are also asking similar questions. But I just want to say, and then I do want to ask you, if they are uncovering these other issues, as you're pointing out, these social determinants of health, and they're suggesting referrals to other people in the hospital, therefore clearly improving care, improving the patient experience. I can't imagine they're not improving outcomes, probably reducing readmissions, et cetera. Do they get training? Is that going to be part of the training of the life care specialist to identify these other issues?
We have a risk assessment tool that they use.
Okay.
Um, Again, the training is very robust. It's motivational interviewing, how to ask questions,
Wow.
non-invasive, non-judgmental.
Yeah.
Everything, all the training is evidence-based. We're partnered with the Trauma Resource Institute, and it is a model called the Community Resilience Model, and it has coping skills to deal with
Hmm.
anxiety, stress, depression, PTSD. If you're in the hospital, you might have all four of those things. Definitely have stress, you're in the hospital, you're having a health crisis. We never look at the mental side. My son was in the hospital so many times and so depressed and giving up. And so was I. And I didn't have the tools and I didn't know what to teach him. I'm
Mhm.
certified on everything too, by the way. I'm a certified life care specialist. I don't do anything that I don't do myself with the LCSs. But my point is, there's the mental side of getting better as well. And the staff that we have in our current hospital setting, nurses are phenomenal. Love nurses. They don't have the bandwidth nor the time. I've had many nurses come up and say, that's why I wanted to be a nurse, is to be able to do the things the life care specialist does. I don't have the time. We have quotes from nurses where they say, and they haven't had training on substance misuse. Okay. First of
Right.
all, no
Right.
training for doctors or nurses, which is insane. Okay. We won't even go down that rabbit hole of the lack of training for the nurses on substance misuse. But because pain was recognized as the fifth vital sign,
Mhm.
they're measured if they keep you in zero pain. So if you say you're at a seven, everybody knows the 1 to 10
Hmm.
smiley face that's on the wall. Where's your pain level? And if you say you're at a seven and above, the only thing they have in their arsenal to give you is a narcotic. It's an opioid. And that's what they do because that's what they've been trained to do. So I'm not criticizing nurses,
Mhm.
but I've got nurses now saying, I don't have to go to that opioid now. My lifeline is
Because The
I call it LifeCare
life care
Specialist.
specialist. What have you found that this, how does it help? Clearly helps the patient, helps their family member, helps the staff on the floor, including the nurses. How does it help the healthcare system, the hospital system?
So it's a hard thing to track. Data, and I know it's all about the data. What I will say is if two people don't come back to the emergency room for pain management, it's paid for the life care specialist for a year.
Two people that you prevent from coming to the ED and you've paid for the life care specialist for an entire year. Okay, drop the mic.
Because,
That's
right? Right? Because here's the deal. If you go back to the
crazy.
ED, if you go back to the emergency room for pain management within that 30-day of being
Hmm.
discharged,
Hmm.
the hospital has to eat that. Insurance won't cover it. So if you are educating people on how to manage their pain so that they're not coming back as a revolving door into our emergency rooms, because if you look at our emergency rooms, how heavy, I mean, they're just so overwhelmed.
Mm.
And so if two people don't come back, that's the other thing that LCS does. If the patient requests once follow up, once they're discharged, we continue to communicate. Are you off your pain medicine? How are you doing? Having that touch point, right, with is helping the patient satisfaction for the hospitals as well.
Okay, Cammie,
So to me, it's a rounding error.
question. Where is this in what, how many hospitals are you in right now? Quick question.
So we are in seven hospitals in Georgia. We're in Emory, we're in Grady, and then the rest are rural hospitals, which I love because the rural hospitals, my gosh, they need help so badly. I mean, 80% of our rural hospitals across the country are really suffering right now.
Wow,
So I've got a big focus on rural as well.
that's great.
But we're also in Arkansas. We received opioid settlement money in Arkansas. So we have life care specialists in Arkansas. When the opioid settlement money opens up in South Carolina, we have had conversations with Duke. Here's the process for it in
Hmm.
regards to the opioid abatement settlement funding. What CWC does is we already have all the grant information because we have the data, right? And so we
Mm.
help the hospital. We provide all the content for them to apply for CWC's program. So we're the vendor. CWC is the vendor. The hospital is the one that's saying to the state, we would like a life care specialist. We would like two life care specialists. It depends on the volume of the hospital, whether you need one or two, right?
Hmm.
It's nice to have two because it's a new position in the hospital. There's not a lone ranger all by themselves, but there are many hospitals where we just have one because the volume only can,
Right.
support one. At Grady, we have three, and that's continuing to expand. So we provide the grant information. We assist the hospital. We handhold through the whole process. Yes, the life care specialist is a hospital employee, but
Mm.
we're the ones that manage them. We do weekly calls with them. We have a hotline for the life care specialist. I'll give you an example. We did the full training with the life care specialist. She's ready to go on the floor. Her first patient was a 9-year-old that took a hammer to her mother and grandmother. Well, did we train for that?
Mm.
That was not a module. What did she do? She called the life care specialist warm line. We walked her through how to handle it, what to have happen. Ended up that that child was being abused. There was a reason that the child
Wow.
took the hammer.
Mm.
But my point is, we can't cover everything. You can't cover every scenario. Every patient's different.
Hmm.
But we have that warm line that is supported so that the life care specialist, so the hospital doesn't have heavy lifting. We're the ones managing that position. And the power of that, give you right before this podcast, every Friday, we have a life care specialist call where every hospital life care specialist is on a Zoom call. The power of that is they're learning by sharing stories. What was your high story this week? What was your success story? What was your low story? What happened? What challenge did you happen? So that's how they're learning to continue learning is to learn from each other, from the different scenarios and the different patients' stories. And then we have continued education on a weekly basis as well, just teaching other skills and so they can continue to enhance
Amazing.
their skill set.
Cammie, I am just in awe of you and what you've built. And I, I mean, I'm listening to this and the question in the back of my mind is, you've been doing this since 2018. That's when CWC Alliance was first created. And again, folks, please go to the website CWC Alliance and check it out. Why isn't this in every hospital in the country? And I'm going to follow up that question and ask you to what can if healthcare executives or physicians or nurses from any system is or large practices for that matter are listening, how can they connect with you to learn more about CWC Alliance, perhaps get a life care specialist into their system?
I would love to. We do a lot of Zoom webinars and to educate hospitals on how you can apply. And I just need to know, it's people like you that are helping. Okay.
Mm.
So bless you, because people don't know what they don't know. So every podcast, every time I can speak, every
Mm.
conference I can speak, I am. Like I said, it's a fire inside of me. I want to
Yeah.
save lives. And so to do that, my North Star
Mm.
is to have life care specialists in every hospital across the country. And I'm not going to slow down until that happens. So it's really just reaching out to cwcalliance.ngo, N as in Nancy, G-O. We have our website, reaching out to me. It's Cammie, Cammie, Cammie at cwc.ngo. Reach out to us. We would love to talk to you. We would love to, we can scale, we can do this. And every hospital, like again, you have to have that executive level support. We're getting ready to have our first conference next week, and it's so
Oh,
exciting for
wow.
me. I just got to share this because
Wow. Where's the conference?
it's at Mercer University School of Medicine. It's an all-day conference. It is on my son's heavenly birthday,
Mm.
September 18th. It's a hard day for me. And so this is a big deal. The
Mm.
dean at the medical school, again, it's about partnership, having champions that partner. And she said, Cammie, there needs to be life care specialists in every hospital in Georgia. And she has helped so
Oh my
much.
God, Cammie, I am really, my mind is just, churning, trying to figure out how to get you in CWC Alliance in front of more people much more quickly. This is happening every single day. People are suffering, and I think this role that you and your organization, CWC Alliance, has created, this life care specialist role, is so desperately needed. You're amazing. Thank you so much for what you're doing at the CWC Alliance. And really just, I want to see, I hope the listeners out there are as inspired by you as I am. And more importantly, that they take some action to support you and get you out there into hospital systems, healthcare systems, and now into this program I just discovered, which I did not know about, your youth program.
Awesome. Thank you.
Thank you, Kimmy.